Hey guys, welcome back. So here's the next video in the ABG series. So if you haven't watched the first video, please take some time out to watch that, and I hope that you find that video helpful. Today I will be talking about acid-base imbalances, so respiratory acidosis, respiratory alkalosis, metabolic acidosis, and metabolic alkalosis. I'll share with you some signs and symptoms, the pathophysiology, or what's really going on, as well as the treatment. If you're interested, then keep on watching. And if you like this video, give it a thumbs up and subscribe. Thanks. Now let's begin. Keep in mind that when you're trying to identify the differences between respiratory acidosis, respiratory alkalosis, metabolic acidosis, and metabolic alkalosis, you want to have the normal values in mind. Respiratory acidosis. Here the patient is not breathing enough, so the patient is hypoventilating. When you hypoventilate, that means that you're retaining, you're holding on to too much carbon dioxide or acid. And remember, as I mentioned in the previous video, whenever you hold on to acids, it causes the brain to mess up. So what can be some causes of respiratory acidosis? It could be trauma, mid-abdominal incision, so maybe, the patient has abdominal surgery and it hurts to breathe, so they're not going to breathe as much because they're in pain. Narcotics such as anesthetics, those will depress the respiration, definitely. Even neurological disease such as Guillain-Barré and myasthenia gravis. And of course there's many more causes, so do your research and figure that out, or I'll leave some right here. So what are some signs and symptoms? So since there's a buildup of acid, it's going to cause you to have a headache. The patient may also be confused and very drowsy or sleepy. And hypoxia. So with respiratory acidosis, the body needs to get rid of all this acid. So here the compensation will occur via the kidneys, because the lungs are messed up at this point. Treatment for respiratory acidosis is to treat the patient with oxygen. They're not breathing as much, so you want to fix that problem. Now let's get into respiratory alkalosis. Here the patient is hyperventilating. They are breathing too much, so they're blowing off all the acid, and therefore they're retaining or keeping the base. So what are some causes of hyperventilation? Anxiety, panic attack, fear, acute aspirin overdose, excessive mechanical ventilation. Some signs and symptoms will be headache, faintness, numbness, and tingling sensations in your fingers and toes. Why? Because the body is having a lack of oxygen. So if there's lack of oxygen, there's no blood circulation to those body parts. So therefore you're gonna find those signs and symptoms to be occurring because the body is trying to tell you, hey, there's something wrong, so you have to fix the problem. So hey, how will we fix this problem? The first thing you want to do is have the patient breathe into a brown paper bag. Now I'm sure you heard of that before. This forces the patient to breathe back in all of the CO2, because remember, the patient is hyperventilating. They're breathing too much, so they're blowing off too much CO2, the acid, and they're left with a lot of base. So remember, whenever there is an imbalance, meaning too high or too low, the body does not like it. It can eventually lead to death. So that's why you would see someone breathing into a brown paper bag, because you want them to trap that CO2 or the acid and breathe it right back in. And also another way is you want to keep the patient really calm, because at this point, if they're hyperventilating, maybe they had a panic attack. Sometimes I have panic attacks when I'm driving up hills, and it's really horrible. But you want to also try to find ways to keep that patient calm. You want to talk to the patient, distract them a little bit so they can calm down and slow their breathing. Now we're going to begin to talk about metabolic. So obviously previously was the respiratory, which dealt with the lungs, and the lungs were the problem. Now we're going to talk about the kidneys, so metabolic. And here, the kidneys are the problem. So in metabolic acidosis, the kidneys are sick. So what would be the pH level here? Do you know? Comment below. Well, the pH level is going to be very low. Remember, acidosis means it's less than 7.35. So here the patient is retaining too much hydrogen. Hydrogen is an acid. Maybe they don't have enough bicarb, which is a base. So here the patient will hyperventilate to get rid of the acid. What are some causes of metabolic acidosis? Because remember, the patient is hyperventilating. It can be diabetic ketoacidosis, that's DKA. And that is when the patient has a very high blood glucose levels. That causes the patient to have increased respirations, and those respirations are called Kussmaul respirations. So they're very deep and rapid. Another cause would be aspirin or salicylic overdose. Intoxication, which we mentioned before. Also starvation, like if a person has anorexia or bulimia, and seizure activity. And also severe diarrhea. Remember, diarrhea, when someone has diarrhea, it contains a lot of acids, so you're letting go of a lot of acids. So a trick that I learned, and I've also heard all over, is that when you think about metabolic acidosis, you know, diarrhea, it comes out the you know what. So that's a good way to remember it. So some signs and symptoms would be hyperkalemia. So there's an increase of potassium. When there's an increase of potassium, there's going to be muscle twitching, muscle weakness, and arrhythmias. Increase in respiration. So they're blowing off too much acid. So as for treatment, you want to treat the cause. It can be any of the causes mentioned previously, and you want to give the patient an IV push of bicarbs, or sodium bicarbs. Now let's talk about metabolic alkalosis. Patients retaining too much base and getting rid of too much hydrogen acid. So here the pH level is going to be high or low. It's going to be high because the pH has to be above 7.45, right? Loss from upper GI tract. So that means from the mouth. It could be from vomiting, or it can be NG tube connected to suction. Also, if a person has a large intake of antacids, that can also cause metabolic alkalosis because a lot of antacids contain base. Maybe the patient received too much sodium bicarb, IV bicarb, or there's a depletion in potassium. Diuretics such as thiazide diuretics. So you're going to be urinating a lot more frequently, and therefore you're going to be letting go of the potassium. Also, depletion of potassium can be due to laxative abuse and Cushing's syndrome. So some signs and symptoms would be hypokalemia, because remember there's a depletion, so it's low potassium levels. Tachycardia, because the body is sensing that something is wrong. Cramps and arrhythmias. So as for treatment, you want to treat the cause, which can be anything that we've mentioned previously, and you want to replace potassium because it's low. You want to give oral potassium. It can be either through dietary measures such as eating a banana, raisins, etc. There's so much more. Or it can be given IV pump. Here's something you should remember. Metabolic acidosis is from the lower GI, so it's going to be from diarrhea, and they're going to have hyperkalemia. Whereas metabolic alkalosis, you're losing it from the upper GI, so you're going to be vomiting and you're going to have hypokalemia. So this concludes this video for the acid-base imbalances, signs and symptoms, and treatments. I hope that this video was informative for you and helpful and easy to understand as best as I can make it. And if you do have any commentary or anything to say, please leave it down below. I'd love to hear your feedback, and if you found it helpful, give this video a thumbs up, and join the FearlessRN family and subscribe today, and do me a favor and share this video out. Somebody may need some help. So if you think they do, then share this video. Thank you so much for watching, and stay tuned for the next video. Bye, stay blessed, and good luck.